And I feel like, based on the research that I'm doing in Austin, and certainly your experience, that is it seems to be the future of fillers worldwide. What do you think?
I think so. I mean, it's kind of split between two ways. I mean, there is a push pretty much from society right now, and social media is basically telling us we don't want to be overfilled anymore. We want to look natural.
Mhm.
And the hyaluronic acids, I mean, if you look at them in terms of like, the way that they've been utilized across the many decades that they've been around, they just simply filled a compartment.
Mhm.
So skin quality, stimulating your own collagen, and so forth. Even though those other materials, such as, for example, calcium hydroxylapatite, polylactic acids, were available during that time, they were not really kind of utilized as much. But now, given the fact that there is definite demand and there's just a ton of research that basically showcases how those materials work, that's the reason why there's been kind of a shift now, a paradigm shift from just the HA fillers to more of the biostimulatory fillers.
So when you're thinking about the biostims, and you are trying to decide between, for example, hyperdilute calcium hydroxylapatite versus a polylactic acid, what are the decision points that you have in your mind as you look at a patient and try and ensure you get the best possible outcome?
So, I mean, there are many different things. First of all, is the phenotype of the patient itself. I mean, are we talking about a patient who is gaunt, who's quite thin? The skin is also quite thin, and they would require a stepwise approach in which you would want to kind of lead to a thickening of basically the dermis to get that, biostimulatory effect. And here you would think about things, for example, such as your polylactic acid. They don't work, they work very gradually. Let's put it that way. They require multiple treatments, but once they are settled in, the results are there for a long period of time. So I would utilize those, for example, for patients who are quite thin and also patients who are Glogau. I love using the Glogau wrinkle scale. So the photo aging scale there for me would be a Glogau type 3 or 4. A Glogau
Moderate
type
to severe, right?
Yeah,
Yeah.
so a Glogau type 2 or 3, those are the less severe individuals would probably, get better results with the hyperdilute calcium hydroxylapatite. So that's the reason where I would utilize that a little bit more. You have more of the natural skin that is still there. It just needs a little bit of a push, a little bit of neocollagenesis. They don't require the polylactic acid effect. So that's the reason why I would utilize CAHA for them.
Practicing in the UAE, I would imagine most of your patients are type 3, 4. Uh, is that right?
I see a lot of young patients actually.
Oh, do you? Yeah.
I
Well,
do,
and
yeah.
I'm actually talking about phototype 3, 4. Sorry, I should
So you're
say.
talking about
Yeah.
Fitzpatrick. Yes,
Yeah.
yes.
Yeah. And so do you feel like there's any difference in the product choice based on the phototype or just on the Glogau type
No,
rating?
it's mainly on the Glogau type.